In a shocking case that has sent ripples through the medical community and beyond, William Bryan, a 70-year-old man from Alabama, lost his life due to a catastrophic surgical error. What began as a relaxing vacation with his wife Beverly turned into a nightmare when Bryan experienced left-sided flank pain. This led the couple to seek medical attention at Ascension Sacred Heart Emerald Coast Hospital in Miramar Beach, Florida. At the hospital, doctors diagnosed Bryan with an enlarged spleen, a medical condition known as splenomegaly. Splenomegaly can result from various causes, including infections, liver diseases, blood disorders, and certain cancers. Now, in a 70-year-old, otherwise healthy male like Bryan, hematological disorders such as chronic lymphocytic leukemia or lymphoma would be high on the list of possibilities, though a comprehensive workup is really necessary to establish the correct diagnosis. The decision to perform a splenectomy, meaning surgical removal of the spleen, is not taken lightly, and it depends on several factors. In many cases, splenomegaly can be managed by treating the underlying condition without necessarily having to remove the spleen. However, splenectomy might be considered in different scenarios, such as a patient having severe symptoms, or the risk of splenic rupture, or if there are certain blood disorders, or when the cause of splenomegaly cannot be determined through other means. So for example, a medical condition that sometimes warrants taking out someone's spleen would be something called ITP, idiopathic thrombocytopenic purpura. In Bryan's case, the doctors recommended a splenectomy. Despite initial reluctance to undergo surgery away from home, remember this was in Florida, he's from Alabama, Bryan was persuaded by Dr. Thomas Shagnovsky, a general surgeon, as well as Dr. Christopher Bacani, the hospital's chief medical officer, that delaying the procedure could lead to serious complications. And perhaps that could be true. So on August 21st of this year, 2024, Dr. Shagnovsky was supposed to do a routine laparoscopic splenectomy. Laparoscopic meaning they just make very small incisions and they stick their instruments in there, including the camera, to visualize inside, and you're putting your instruments, your tools, through these little holes in the belly. It's less invasive. In an error that defies explanation, instead of removing Bryan's spleen, the surgeon inexplicably removed his entire liver. This grave mistake led to catastrophic bleeding as major blood vessels were severed, resulting in William Bryan's death right then and there on the operating table. The magnitude of this error is difficult to comprehend in modern medicine. The liver and the spleen, while both located in the upper abdomen, are distinctly different in size, shape, and position. The liver is a large reddish-brown organ weighing about 3 pounds in adults. It primarily sits in the right upper quadrant. In contrast, the spleen is a much smaller, fist-sized organ located in the left upper quadrant. So for a trained surgeon to confuse these organs seems almost inconceivable. Another interesting detail in this case is that the surgeon actually placed the liver into a bag that was labeled as spleen. So in other words, that bag had a label on it that said spleen. It was meant for the spleen, and instead of the spleen going into that bag, it was the liver. As investigations into Bryan's death began, a disturbing pattern emerged. This wasn't Dr. Shagnovsky's first major surgical error. Just a year earlier, in 2023, he had reportedly removed portions of a patient's pancreas instead of the intended adrenal gland, another case of mistaken organ identity. This revelation added a new layer of complexity and concern to the case, raising critical questions about medical oversight, continuing education for physicians, and the systems in place to identify and address repeated mistakes. To understand the gravity of removing the liver as opposed to the spleen, it's crucial to comprehend the liver's vital role in the body. Long story short is that you can't live without a liver. You pretty much die immediately. That's because the liver isn't just another organ. It's a powerhouse of essential functions. It receives about 25% of the body's blood supply. It regulates blood sugar. It processes toxins, even something as simple as Tylenol. If you take too much Tylenol, yeah, that could be deadly, but the reason why you can take so much Tylenol is because the liver is actually modifying that chemical, that drug, to make it so that you do not have toxic effects from it. It gets rid of the toxin aspect of it. So that's why Tylenol is generally considered safe, but it wouldn't be safe if your liver wasn't working properly. That just goes to show the importance of what the liver does. It also makes clotting factors and other essential proteins. It serves as the body's primary filter. So when the liver is unexpectedly removed, death can be almost instantaneous. The body simply cannot function without this crucial organ, even for a short time. There are several factors that could potentially contribute towards such a grave mistake, though none fully explain the magnitude of this kind of error. For example, there are rare anatomical variations that can happen in the body. There's something called wandering spleen. There's another thing called situs inversus. So situs inversus is essentially the mirror effect, where you have the left and right and left that are flipped with organs. So for example, some people with situs inversus can have their liver on their left side while their spleen is on the right side. Essentially, they're flipped. This is something that is picked up at an early age. So the chances of someone having newly discovered situs inversus and someone who's 70 years old is highly, highly, highly unlikely. And of course, they would know that in this case if that were the case. So besides rare anatomical variations, what about cognitive impairment? That raises the question is, was the surgeon cognitively impaired? And there's many reasons to be cognitively impaired. It could be a medical reason, whether it's a brain tumor. It could be a psychiatric condition. It could be a sleep disorder where someone is extremely fatigued and cognitively impaired as a result of a sleep disorder. And there's other possibilities too, which we'll get into in a little bit. There's also systematic failures. So failures within the system, whether it's a failure in communication or safety protocols. And then we have another possibility to consider where things can go wrong. There's the challenges that are specific to doing laparoscopic surgery. All of these have been suggested as possible contributing factors. However, the repetition of such serious errors by the same surgeon has led to speculation about the possibility of something more sinister going on. What could that be? Well, intentional misconduct. While extremely rare, cases of intentional malpractice for organ harvesting have been documented in other parts of the world. However, it's important to note that such speculation remains unproven and should be proceeded with caution. The Bryan family has filed a lawsuit against Dr. Shaknovsky, Dr. Bakani, and Ascension Sacred Heart Emerald Coast Hospital. The case raises significant legal and ethical questions about how surgeons with a history of serious errors are monitored and regulated, what responsibilities hospitals have in overseeing their medical staff, how patients can be better informed and protected when undergoing procedures, and what systemic changes are needed to prevent such catastrophic errors. The lawsuit not only alleges medical malpractice, but also fraud and conspiracy, claiming that the doctors misled Bryan about the urgency of the surgery and his ability to travel home for the procedure. This case serves as a stark reminder of the critical importance of patient safety in healthcare, and it also underscores the need for enhanced safety protocols, improved oversight, transparency, continuous education, and system-wide accountability. The tragic death of William Bryan, it's more than just a medical error. It's a systemic failure that cost a man his life and shook the foundations of trust in medical care. Do you have a question about this medical case? Just click on the link below.